So, this morning we are going to be talking about workplace wellness. Um, Angelica just gave me a wonderful introduction and my background and everything, but just a couple of things I wanted to highlight in terms of my personal experience with the topic today. I have been on the front lines for most of my career, actually, before stepping into the role that I'm in now, and for several years here at CMHA, I was one of two vocational workers within the whole organization. There's a few more now in different services that we have, but it was largely me kind of working directly with clients on the types of challenges that we're going to be talking about today and working through those. And in addition, my own lens of having lived experience with mental health and addictions challenges. So I'm very much someone who identifies as living in recovery. So the topic today is very near and dear to me, personally and professionally. So I hope everyone enjoys the next hour or so. Angelica is going to moderate the Q&A function for me, so please feel free to type in any thoughts or questions if anything comes up for you during our time together today. And thank you again for having me, everybody. So, to start off, I just kind of wanted to provide an overview of the state of mental health challenges in our country today. So, I should mention the data that you see here is as of 2022, and keep in mind we were just coming out of a global pandemic at this time, but still fairly up to date and gives you a rough idea of some of the numbers relating to mental health and the impact on workplaces. So, in 2022, roughly 5 million Canadians met the criteria for a diagnosable mental illness. So, mental health challenges in our country are quite prevalent. And I always think about the issue around statistics is this is just the people that are reporting these types of challenges. So if you think about the amount of people that go undiagnosed, people who don't reach out for help, people that might not even be really aware that they have a problem, numbers are likely much higher, but again, this is the data that we have. 1 in 3 Canadians will experience a mental health diagnosis or mental health challenges in their lifetime. So more prevalent as our years go on. And I think that really speaks to how all of us are affected by these challenges, even if it's not ourselves going through them. When we think about friends, family members, colleagues, people in all the other communities we're a part of, maybe our faith-based communities, anything, any community that we're involved with. It's something that touches all of us at some point. In terms of workplaces, addressing mental illness, mental health challenges, is complex, and I know from experience a lot of workplaces struggle with this. But you see the cost here for companies, and I think these numbers really highlight the cost and the ramifications of not addressing mental health in the workplace. Um, you might notice that mental illness represents a small amount of disability claims statistically, but the cost of the economy, for instance, is quite high. And just a couple thoughts on that. I don't think there's one exact reason why, but mental health resources are often costly, not necessarily all workplaces have coverage for them. Culturally, we have this mentality of just kind of suck it up and get on with it. I think all across cultures that can be true. But resources such as therapy often it's lengthy in addition to the cost. Therapy, if anyone here participated in any type of therapy, it can take multiple sessions to kind of work through challenges that you're having. That can take months or even years. And mental health can just go unchecked for those amount of years. So not addressing mental health challenges, even if they are maybe more minor, they can grow to be more complex as time goes on. I do want to highlight that it is certainly possible and likely that living with a mental health diagnosis equals having positive mental well-being. So lots of people who have a diagnosis live very happy, fulfilling lives where they are contributing to their communities, they're contributing to their workplaces. So having a diagnosis isn't the be all end all. Um, and also, someone can have a low level of mental health, you might say, and not have a diagnosis at all. So, we think about if we're under high amounts of stress for long periods of time. Many people have coping strategies that maybe might feel good in the moment, but are not helpful long term. So, it does create challenges, but lots of people, I just want to clarify, having a diagnosis doesn't necessarily mean that people aren't able to show up to their workplaces or other communities that they're involved with. So this slide kind of gives some overarching points about information I'm going to be discussing today. And we're going to dive into these points a lot. But advocating for a mentally healthy workplace really starts with a lot of these points. So, access to resources, for instance, it's so important to get into this mentality and thinking about it not just as a benefit, but as something that's mandatory that is needed in the workplace. Um, Resources, tools, and support at work is essential, really, for a workplace to thrive. I think talking about mental health in a workplace is something that's becoming more forward thinking, but it's just smart to do. It prevents burnout. Employees feel more empowered when they're able to talk about these challenges. Increasing awareness, and reducing the stigma. So, and maybe all of these points are organizational, and in terms of policy, they may start at a higher level, but all of the pretty much everything that you see here can be done at all levels. So really thinking about fostering an inclusive workplace and how that can lead to a more cohesive team, using your own knowledge of good resources as an employee as well. It's so important to show up authentically, and how thinking about how that allows us to show up for and supporting each other. It makes conflict less likely, difficulty, uh, difficulty when processing change management challenges are lessened. Um, we all contribute to a mentally healthy environment, and I think this can be hard. When I think of it from a leadership standpoint, there's maybe not a lot of time or money or training in order to model supportive behavior. And employees don't necessarily aren't necessarily motivated to contributing to a workplace culture. But just thinking about the annual cost that I highlighted, focusing on mental health is just really smart business strategy in order to keep everyone engaged, productive, and just loyal to the companies and organizations they're working for. But there are, of course, a lot of barriers. Establishing psychological health and safety it's not necessarily mandatory at workplaces, but it is an important step for employers to take. When we see that more in workplaces, employees are less likely to, or when we see that not happening, employees are less likely to speak up about stress or when they're burning out. or mistakes that may have happened, especially when they're fearing that there may be negative consequences or a negative long-term impact for those challenges. So a goal of this workshop and the outcomes of the workshop are talking about common challenges when addressing mental health. I think it's very easy to misinterpret behaviors. Maybe people are withdrawing a little bit, or if people maybe seem like they're on the irritable side. But this can really lead to unfair judgments. So without awareness, um, and support and resources are underused or accessed too late. Considering the stats around the prevalence of mental health challenges, data shows that Canadian workers either can't or won't seek help or support from their workplaces. So employees may hide mental health concerns in order to avoid being perceived as unreliable. Um, Conversations are avoided about these challenges or they're minimized. And really, it just reinforces a culture of silence at work and other communities that we may be a part of as well. And I mentioned too, but leadership in a lot of workplaces are not adequately equipped to address the influx of mental health challenges and concerns because it just hasn't been a focus at work historically. And I think because of that, responses, even in the same workplace, can be inconsistent from leadership. You might get leadership that's reactive or harmful, unintentionally harmful, I'm sure. But if conversations aren't had in a focused, productive way, it can cause more challenges, undermine trust, and confidence across teams. And when people, of course, in workplaces, I want to acknowledge when our colleagues are falling short, their peers are forced to take on more work, and this can also lead to emotional strain. We lose compassion for our colleagues if they're kind of dropping the ball. Resentment can build, and that leads to even more stigma, sadly. So thinking about how we can help build work environment where conversations are regular and how they can be started by employees or management. But when these challenges and these barriers are happening, conflict can increase and there can be a lot of changes that happened where tension is created. And if that goes unresolved, there can be a lot of stress and uncertainty. So I want to take a minute to think about conflict in the workplace, and we'll in the coming slides we'll talk about practical strategies to reduce conflict in the workplace, but also implementing ideas to work away from that in terms of ideas around mental health too. So probably everybody may have experienced these types of challenges in a workplace before. So these are some general reasons why conflict can occur. So different expectations amongst teams. Conflict arises when expectations are not really clear or unrealistic. And when it comes to mental health challenges in the workplace, there can be unspoken assumptions about roles, performance, or behavior, and this can lead to disappointment or resentment. There's time constraints in workplace. Time and pressure around deadlines can increase stress, reduce patience in our colleagues, and it can limit thoughtful communication when people are kind of feeling rushed or overworked. There can be inequality in workplaces, which sometimes is just how things need to be. Of course, there are people working on the front lines, there can be middle management, higher level management, and so on and so forth. So there's this kind of natural hierarchy that can happen in work, but because of that, there's not always a balance in authority, decision making, power, um, access to information, resources. But these power dynamics can discourage having an open dialogue about mental health challenges and can cause tensions to surface indirectly. But of course, even when there is equality, we can have different viewpoints or values at workplaces. So, especially living in Peel region and the GTA, it's a wonderful area to live and work in many ways. We have colleagues that are bring all kinds of diverse backgrounds and experiences and beliefs into the workplace. Without psychological safety, which I'm going to expand on in the coming slides, differing perspectives can be seen as off-putting, threatening even. People may think they're losing opportunities, so it can be a challenge to work through. I'm sure we've all worked with people that just kind of have a lack of communication ability, or what we think might be a lack of communication ability. I'm chuckling. Maybe I'm speaking from personal experience as well. I don't know. But a challenge with mental health is that you may have people that aren't acknowledging or even unaware that they may be having difficulties. So when those issues are avoided instead of addressed directly, tension can very much build over time. Different needs or interests at work, absolutely. There can be a balance between support and getting work done. Conflict can emerge when people feel like their needs are not getting met or when they're overlooked or undervalued. And sometimes we show up and we're just not in the greatest mood. We all have stresses in our lives. We can feel fatigued, burnt out. Personal challenges can influence our emotional responses to what's going on at work. So sometimes we come in or we're interacting with others that may have heightened emotions. Empathy might be reduced, and this can increase people's reactivity. So when mental health is strained, our tolerance levels for frustration can decrease, which makes conflicts a lot more likely. So some questions here around our approach to addressing conflict. So you'll notice these questions in general just help us recognize and regulate our emotions a little bit instead of reacting impulsively to situations. So kind of building a little on emotional intelligence, which is very much linked to resilience and well-being. But thinking about conflict through this lens reduces anger, blame. It reduces the chance that we're personalizing conflict. Um, these questions very much encourage curiosity rather than judgment and helps prevent unnecessary emotional escalation or anxiety. These encourage reflection that you might think of as value-based rather than ego-driven. And also just highlights the importance of social connection and cooperation at work. Positive relationships in general are very much a protective factor around our mental well-being. So that's very true for our relationships at work as well. It's the people we a lot of us spend most of our time with actually is our colleagues. So, really not undervaluing those relationships is really important. And these questions support long-term thinking over short-term emotional relief of engaging with someone in a negative way, I'll say. So what the slide is really saying is that you really need to know yourself when you're approaching a conflict situation. So it's like to reflect a little bit further, it's like what happens to me when conflict is arising? How am I reacting? What's pushing my buttons? What is irritating me about this situation? What are my beliefs and attitudes about the situation that I'm kind of bringing to the table? And maybe even, what is my personality type? How am I coming across to other people? Sometimes our reactions don't always match up with what our feelings are, and that can be frustrating. But having some self-awareness there can really help reduce the chance that conflict is going to be escalated a little more. So these conflict resolution best practices kind of shift conflict away from being personally threatening to thinking about it as a shared workplace challenge. So supporting healthier relationships, stronger teams, and a more resilient work culture. So it's really a lot of that self-regulation stuff that I was just talking about and thinking about how that comes even before problem solving. So managing our emotions, even breathing and eating, making sure we're feeling physically well before entering these challenging situations really helps prevent escalation and supports clearer thinking and healthier communication. So being intentional about communication and how that can reduce misunderstandings. Um, Trying to understand the other person's experience, certainly. Empathy, very important, can reduce defensiveness in all parties involved and really fosters the goal of having an agreement out of the situation. So we're focusing on common ground and supporting collaboration. So highlighting agreements helps maintain momentum and keeps conflict solution focused rather than adverse. Of course, boundaries and support systems are very important because not all conflicts are going to be resolved face to face or by the maybe two or a couple more parties that are involved. So really remembering when you need to involve a supervisor or human resources, for instance, and making that known in terms of process really reinforces that employees are not expected to handle conflicts all on their own. And this also helps prevent isolation, burnout, and prolonged stress. But what we're really thinking about is how we're supporting each other. Excuse me, everybody. Thinking about how we're supporting each other at work. And again, I think, we are at work at the end of the day. Like I certainly recognize that, and there is certainly a balance between helping staff and the workplace and not turning into their counselors or their main mental health support. That's not necessarily the goal. And also these conversations, when we're having conversations around mental health challenges at work, can seem hard. I think a lot of people wonder, um, there's questions around how can I ask someone if they're okay? How can I approach this situation? Um, Proper leadership practice can make employees a lot more comfortable with addressing these situations as well. So, maintaining a workplace culture of trust and honesty and fairness really makes for an environment that's conducive to good mental health and enables everyone to approach these situations. Um, on a practical note, you certainly want to be aware of your verbal and nonverbal communication when you're addressing mental health challenges. So, appropriate eye contact, leaning forward, nodding your head, tone of voice, avoiding interrupting people. So, providing time for the person to think and finish what they're saying. You want to keep an open mind when you're talking about mental health challenges. So being patient, respecting the person's feelings, listening to their needs, and kind of validating and normalizing. As a supervisor, for everybody, but as a supervisor or as management, we're not probing or attempting to make a diagnosis of the individual. We're not using language around just get over it, trying not to be accusatory, meeting the person where they're at and redirecting to accommodations or solutions in order to continue to execute work tasks and get the job done. That's exactly why we're here. So it's solutions that focus on the impact of their work. Um, you may think about delegating work based on skills or the abilities of employees and thinking about what the tasks are that are required to be performed, but who can perform them when possible. Um, and think about it. Um, as rights versus consequences. So individuals, when we're at work or if there's a work plan kind of in place for people to complete their work, individuals do have the right to refuse treatment or plans like that, but refusal does impact accommodation or job performance. So, you might think of the example of people that are on a return to work plan. Maybe they've been off for a few months. There's agreements and policies that are in place that require treatments as a condition of reinstatement. These are important and employees must follow these plans, but they must be reasonable and consider individual circumstances as well. I'm going to speak a little more about that. There's more practical strategies on that coming your way. But first off, I want to just continue to highlight the importance of authenticity at work on all levels. We all play a role in showing up authentically. And I think what that means is just having an awareness of our own mental well-being and how that can improve collaboration, leadership, decision making. Just thinking about how we're all human beings, right? We're not just our roles. We all have challenges in our lives. We have family members, friends, all kinds of struggles that are going on. So more authentic communication about where we're at can lead to better teamwork, empathy, and leadership credibility even. So thinking about increasing transparency. Um, and when things are changing at work or when there's work decisions being made, that can include sharing decision rationale, even when outcomes are difficult, following through with what you're saying you're going to, or explaining when you can't. Um, Thinking about support, coaching, mentoring, leadership as tools for emotional intelligence and self-regulation. So I mentioned earlier, but problems being addressed early on and how that reduces bigger challenges. Thinking about how there can be a stronger sense of collective ownership and care. Of course, we need to be maintaining healthy boundaries when we're at work. So, normalizing saying no when possible, normalizing taking breaks, unplugging if we're working virtually, focusing on learning and not perfection. Leadership really sets the tone and models behavior, but also can advocate for allocating resources. So, checking in with your employees regularly, spotting challenges earlier if you're noticing any warning signs that people might be burning out. But it's also on the responsibility of employees to care for themselves and support each other too. So a couple more slides on change management, which can be another common challenge in workplaces. So these are some points, just some common all across all different types of jobs that can impact people's ability to move through change. Um, there can be a lot of loss when change is happening at work. So resistance to change and any aspect of our lives is very much rooted just in our need for safety and trust as human beings. So not necessarily an unwillingness, it's just biologically we can be resistant to big changes in our lives. Um, Being in the nonprofit sector for a good chunk of my career, I can say that change is constant. Um, Services and programs lose funding. Job retention can be hard. The scope of your work can change and shift as services change and shift. Um, so it can feel it's something that can really threaten our identity, our role clarity, um, even our livelihood, and this very much triggers anxiety and resistance. So people are more open to change when they are feeling psychologically and financially safe. We may not see that there are a lot of benefits to change. The benefits can be unclear or uneven, maybe. Change can feel like a lot of extra effort without a lot of payoff. So our motivation increases when people understand kind of what's in it for me and what's in it for the team. Um, Without a shared understanding of the problem that the change is addressing, it can feel very disruptive rather than purposeful. And a clear, so having the clear rationale and transparency can really help with building trust when there's a lot of change going on. And sometimes there's just peer, these psychological challenges that are happening. So like peer pressure, there can be group norms amongst teams which can strongly influence behavior. Resistance can spread very quickly if influential colleagues or peers are skeptical. Um, Having visible support from these unofficial leaders, I guess, can really champion and help shift perspective and norms. And sometimes there's fear. There's a lot of fear with change, fear of uncertainty, which increases stress and can lead to kind of thinking about worst case scenarios. So regular communication and clear timelines really help reduce anxiety and build confidence. But there can be that lack of trust. We may have past experiences with change in workplaces or at previous workplaces, which were poorly managed. So change, the 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 credibility of management can feel kind of undermined. So the trust around these situations really grows when leaders are consistent, honest, and follow through on commitments whenever possible. And it can just feel like bad timing sometimes. Change is introduced maybe during high periods of workload, burnout, organizational instability, and this can be very overwhelming to employees. Um, Pacing change as much as possible can really lead more to a readiness for success. So just like conflict, change is something that's very much unavoidable in workplaces. So having flexibility at all levels can really help us adapt and grow. Being more open-minded allows us to work in new ways and embrace new processes. So our minds, our mindset really does matter. And, I think a lot of us, just as human beings, can put a lot of weight on negativity. We hang on to anger a lot as human beings. And this can really shape our experience as well. Even though it's actually funny because our brains neurologically really do benefit from change, actually. New ideas and new situations that we're in stimulates learning and there's science and data around our new neural pathways and connections, which I'm not an expert on and won't get into. But change is actually overall it's a good thing. It's a good thing when it happens to us. So it's important to pause and identify what emotions the change that we're going through is triggering in ourselves and kind of asking yourself, what am I resisting? What is in my control in this situation? What do I need to feel more positive about changes that are happening? It can really make challenges relating to this more manageable. thinking about what's the worst that can happen, but in a positive way. Maybe just being more mindful of that can help reduce anxiety by putting our fears and our concerns into a little more perspective, and being honest about how these challenges are affecting you. When possible, it's always helpful to kind of take baby steps when working through change. So testing and adjusting processes can help to build confidence and momentum. Even small wins can make things feel more achievable rather than overwhelming. So I do want to acknowledge having optimism around these types of challenges doesn't necessarily ignore the reality, but it does help separate facts from feelings a little bit. So encouraging that self-reflection and positive self-talk can help individuals to feel grounded. So even just kind of affirming, you know what, I'm okay. I'm capable of working through this. I can do this. Um, And on the flip side, I just want to say it's important to avoid toxic positivity. So, it is certainly important to acknowledge when we are feeling stressed or fatigued or burnt out. We need to let go of I guess you might call it people pleasing, and allow ourselves to have more honest and healthy responses. So really it's preparing yourself by considering what the challenges and the possibilities are. So separating facts from feelings so you can kind of process both. Ideally, workplaces, and I know this isn't always the case, but workplaces should involve employees in processes around change. That level of engagement really does increase a sense of purpose and control during these situations. So, looking for ways to influence outcomes um, rather than feeling passive about it. Looking at where employees can develop new skills in order to plan ahead and stay adaptable. We want to make sure we're listening to each other too, listening to others so that we can strengthen collaboration and generate better ideas. So learning, collaboration, connection, all can help challenges relating to this more meaningful. Talking to each other can provide new insights and reassurance as well when we're looking for support. Um, and thinking about who the available supports are in workplaces, managers, mentors, employee assistance programs, looking at where we can support others too, to create connection and reinforce resilience for everyone. Um, and again, I want to acknowledge big changes cannot they just don't feel good sometimes. Sometimes change we feel like just genuinely doesn't benefit us, and that reality very much matters. So thinking about what your personal and professional supports are as well, whether that's family members, friends, professional supports. Could be, I mean, EAP, but therapists, medical supports, any sort of community that we're involved in are outside of our work life as well. So making sure we're utilizing those. So I want to talk more in terms of the next few slides around practical strategies to improve employee mental health when we're at work. So culture at our workplaces. So there's our rules, there's policies and procedures, but there's also organizational culture, which varies. And I think I try to make these points in the coming slides as broad as possible for all workplaces. Um, so culture is, I guess the best way to talk about it is really how people are showing up and behaving at work. And this often means how we are as employees, how we're behaving under pressure, maybe, or as we're working through work tasks. So employees. really do watch out for what leaders tolerate, what gets rewarded, and what they're modeling themselves. So values around organizational culture need to be specific in order to guide behavior. So, first of all, leaders must model not just boundaries, but vulnerability and psychological safety. If, for instance, leaders aren't taking paid time off or openly discussing stressors, then employees might not either. So some practical ideas for articulating expected behaviors or some practical questions that you might ask are like, what does respect look like? What does it look like in meetings? What does it look like in casual conversations? What does healthy workload management look like? What is acceptable after hours communication? Um, what does supportive leadership look and sound like during performance conversations? You really do want to look at performance management, promotions, rewards, things like that. People pay attention to who gets promoted and who moves around at workplaces. So you really do, which is important, but you want to look for opportunities also to reward collaboration, empathy, effort, not always output, even though output is very important. We all have priorities, work tasks, outcomes that need to be completed, but you want to look at acknowledging good cohesion and efforts around that, and even just employees who take care of each other too. Um, Addressing issues early. So something that's I mean, continues to come up throughout this workshop is really looking at addressing challenges because again, everyone at work does need to be held accountable. Um, and maybe especially leaders, but from a leadership lens, you really do want to tackle any sort of behavior that's toxic at work very quickly and be consistent with that because small problems can lead to um, more problematic, bigger patterns when we're ignoring them. So early intervention around mental health challenges prevents burnout. It prevents employees from disengaging. It can prevent turnover and different roles in our teams. So addressing issues early not just shows fairness, but it builds trust. Um, and inviting employees to vocalize around culture and a culture around a mentally healthy workplace as well. You can think about this in a couple ways, even maybe building mental health as a metric into evaluations around workplace. So using employee feedback surveys, focus group, you can do listening sessions. So there's things you can implement in terms of strategy and policy. And I'll be talking more about that in the coming slides as well. So there is culture and a part of mentally healthy workplace is providing resources and just awareness around mental health challenges too. So it's really thinking about treating mental health supports just as you would um, just as you would anything else in terms of like non-negotiable policy or infrastructure. So it's like mental health support, thinking about it in the same way as health and safety practices or IT practices, even thinking about it as essential part of the infrastructure at work. So um, for instance, you can provide consistent access and awareness to any employee assistance programs that might be available, and even if you don't have that, you can advocate for other mental health resources as well. Um, as for any leaders that are here, focusing on where you can do some coaching and thinking about coverage around mental health supports. So looking at where you can advocate for that. Um, Modeling around taking mental health days that don't require justification. So where can we advocate for more paid time off as leaders? Um, of course, knowing that employees have resources like supports they can go to and time they can take, it goes without saying. This very much reduces burnout, absenteeism, and just helps employees to have a higher focus, higher energy, and creates more sustainable situations for higher performance. Um, Having education and more visibility around mental health training for all employees, not just managers. Um, there's different organizations such as what we're doing right now through CMHA, where you can access workshops on stress, burnout, anxiety, resilience. So thinking about opportunities to offer preventative education. Um, this can remove friction and having simple access, clear communication on confidentiality. Just another way to have earlier support seeking can build stronger trust and psychological safety. But we need to kind of normalize conversations, even if you don't have the opportunity to have resources or extra time off or any external parties coming in. We need to just kind of normalize that mental health challenges exist. So leaders can openly reference any resources that are available. Um, Making sure that employees know what their benefits are, making sure that's introduced not just during onboarding, but making sure that we are revisiting our benefit packages regularly. Um, Normalizing conversations, maybe in terms of internal campaigns around mental health. There's like mental health awareness months. You might think about even informally storytelling from leaders or peers in a voluntary and safe environment. Just encouraging everyone to be able to model vulnerability appropriately, of course, moves away from kind of that power through and always having to be on culture. And this is where employees don't fear negative consequences for speaking up as well. So building psychological safety into strategy. So thinking about mental health as a key performance measure, even. So well-being not being separate from performance, thinking about well-being as something that drives performance. So regularly assessing mental health needs through surveys, check-ins, and using data from those as well. The result of that is just healthier employees delivering more consistent and sustainable performance. I've talked about recognizing effort throughout this, but I just want to drive it home a little bit more because when only results are rewarded, employees may hide struggles, they may cut corners when doing work. So really recognizing efforts reinforces persistence and collaboration and learning amongst teams. Um, normalizing time off again. So being able to take mental health days without any stigma attached to them. Encouraging the use of vacation time when needed. Looking at where we can address workload and clarity around workload too. So whether that's through regular reviews, communication around clear expectations and priorities at work. The goal is always to build psychologically safe teams. So normalizing questions and feedback from employees, normalizing wherever possible freedom to kind of experiment around task completion, focusing on systems and processes, not just blame. Um, I want to mention, and I don't focus on it as much in this, but I do workshops that are more around the processes of disclosing your diagnosis to your employer, returning to work policy and all that. There's lots of information on this you can find through like the Ontario Human Rights Code and WSIB, lots of guidelines that are mandatory around roles and responsibilities of workplaces and of employees and what is expected of both. So resources like that do provide a clear pathway that workplaces can align with and use to enhance a supportive environment while maintaining expectations and boundaries for employees. I talked earlier, but as employees are at work or returning to work, there may be requirements around treatment or expectations around that are conditional as they're working or being reinstated. Um, of course, these must be reasonable and consider individual circumstances depending on the situation, but they are there. They are there to ultimately help make sure that tasks are getting done. But you can still do that in a supportive and collaborative way. So just about to wrap up, folks. So just last couple slides are around the ideas that I've chatted about today. So well-being directly impacts results when we're at work. So investing in it as a workplace is so important. You want to treat all these mental health strategies, whether it's in policy, whether it's in day-to-day practice, as kind of like a return on investment, not just a cost. So continuously improving workplaces um, based on based on what you might see other workplaces modeling, but also you really it's so important to get feedback from your employees on this. This leads to higher retention, more employee engagement, better performance, more innovation, which is crucial. It's so crucial. Employees need to show up to jobs that they don't hate. We all want that. So happy employees equal happy workplaces, and supportive workplaces equals more engagement. Um, I talked earlier about the cost of mental health challenges, and the cost of sick time. So thinking about it like that, but also being more focused and effective. We want to make life as easy as possible for all of us when we're at work. So really looking at these things as fostering a sense of belonging, to improve retention, foster innovation, and just leading to growth. So being more proactive around this, and employees as well, taking accountability for their own mental health. Um, employers more so are responsible for creating that resilient and adaptive culture, but everyone at all levels really do contribute to it as well. So good health just leads to good business. And mental health is not really a performance driver. It's not really a soft issue. Well-being directly impacts results. So really looking at where you can define reasonable working hours and response time in terms of expectations, um, discouraging after hours work whenever possible, unless it's truly urgent, or unless there's clear communication around flexing work hours or compensation for working after hours. Um, Really looking at education though and awareness, learning. Learning is part of the job, not just something that's done on top of work. So looking at where you can dedicate learning hours, if there's any funding you can allocate in terms of your budget, that could be for coaching, trainings, attending conferences, maybe. You really will always want to encourage a growth mindset while you're at work. So rewarding learning and experimentation and connecting skill development to individual and business needs. Lots of things can be done informally too, though. Just really recognizing efforts, doing those regular shout outs to your colleagues, whether that's during meetings or just kind of peer to peer. Um, Acknowledging what was done and why it matters, looking at where you can recognize maybe work that's not necessarily visible. You know, we're all doing work that can be labor intensive sometimes. I talked about acknowledging collaboration, problem solving. Anything you can do to boost a higher level of morale and motivation and a stronger sense of belonging. So being as flexible as possible as you can with deadlines, responsibilities, stressing that taking frequent breaks can help employees recharge, boosting skills, really thinking about how that makes for a dynamic workplace, having a sense of purpose, how that connects to well-being and helps employees to feel like they're building on their career. Any opportunities you can to boost morale and encourage collaboration, validating each other, even just saying like good morning and thank you can really make a difference in someone's day. It sounds like such a small thing, but it can be powerful. Including employees in decision making and making sure there's no fear of repercussions for engaging or speaking up about challenges is also crucial. And being transparent. These conversations are hard. Conflict and change, which I talked about, are natural parts of work, and there's not always easy resolutions to those things. So transparency and accountability wherever you possibly can is also hard, but having open and honest communication can really minimize these challenges and just lead to more cohesive, mentally stable environments.